Gynecomastia is enlarged male breast tissue. So gynos means female, whereas mastia refers to breast. So gynecomastia is enlarged breast tissue in men, and it can range from puffy nipples to enlarged breast with excess skin. How do you know you have gynecomastia? Basically, every enlarged breast tissue is not abnormal, but if it's affecting the way it looks in your clothing, if it's affecting your confidence, then you know that you're suffering from it. And there's many ways of treating this. One of the other features that people with gynecomastia have is that sometimes you can have symptoms, which is very rare. You can have a bit of discomfort, pain, or sometimes rarely discharge. In some patients, the areola, which is the dark part of the breast skin, is also enlarged because of the stretching of the skin. And not all patients who think have gynecomastia have enlarged breast tissue. So if you think gynecomastia is what you're suffering from, then you will know, because it can become obvious. True gynecomastia is caused by enlarged breast tissue gland, whereas pseudogynecomastia, which is gynecomastia caused by fat, is caused by just accumulation of fat in the breast tissue. True gynecomastia is enlarged gland that can be caused by either physiological reasons or abnormal reasons. Physiological reasons is basically when you, for example, when you're born, sometimes newborns have got enlarged, slightly enlarged breast tissue, and that's from their mother's hormones, maternal hormones. And then when you're going through adolescence as a male adolescent, you also have abnormality in the proportions of your female to male hormones. And then the last stage is when you're in old age. There's also abnormality in the breakdown of hormones or the production of hormones, and that changes the proportion again, which can result in gynecomastia. The other abnormal causes when, for example, you have a medical condition, either liver disease or in the production, either that means breaking down the hormones or production of the hormones. That can also affect the level of your hormones, for example, liver disease or testicular disease when there's increased production. Then you have medicines, for example, some prescription drugs have side effects of gynecomastia, or these days, which is more common, is bodybuilders or people using prohormones and anabolic steroids. That definitely changes the balance of your male to female hormones, and one of the side effects is gynecomastia. There's again, these days there's a lot of exposure to industrial chemicals, pesticides. These to some extent can affect your proportions of male to female hormones, and as we know. Gynecomastia is quite common. We are taught that it's 1% of the population, but there are studies that have been shown that it affects up to 50% of males' autopsies. Of course, not all of them suffer from gynecomastia, but enlarged glands is present in more men than we think. In my practice, I've seen a lot of increase in men walking in with gynecomastia because either they've used anabolic steroid hormones or they've gained weight, or they've had it in their teenage years and the gynecomastia has persisted. And also we know that these days there's more exposure to pesticides, industrial chemicals and prescription medication, including for hair loss, for example. And all these, to my experience and belief, is that there's a bigger number of people suffering from gynecomastia than we think. Once you've ruled out sinister causes, and if it's still affecting you, then it is cosmetic surgery. The way we treat this depends on what you're presenting with, the grade of your gynecomastia. It ranges from puffy nipples to large breasts with excess skin. So that means the treatment can just mean removal of gland or liposuction only, or both, which we do in more patients, both gland removal and liposuction. Some patients need body sculpting, and some will need all these treatments with removal of the excess skin. My approach is local anesthetic because I feel it's safer, and in my hands it's more efficient and quicker. Patients don't have to stay in hospital and they don't have the downtime they have with general anesthetic. And also the patient participates in the treatment, and I can communicate with patients. So the treatment, the aftercare also depends on the type of gynecomastia you have, whether you've had liposuction or you've had gland removal. So if you have any more questions about the treatment, feel free to contact me. Thank you for watching.